Good morning. Thank you for all coming out. I'm going to be presenting some work from my team, which is the Built Environment and Health Research Group. I also wanted to note that Mailman School of Public Health has recently launched an obesity prevention initiative, which I have the honor of co-directing with Claire Wang, and so we're hoping to be rolling out some events through the obesity prevention program. I want to talk about two projects today, one of which is something we've been done in very close partnership with the Department of Health and Mental Hygiene to pool the community health surveys that are done annually by the Department of Health and then link the data from the community health surveys via the zip codes of the respondents to look at how neighborhood characteristics affect diet, physical activity, and BMI among these respondents to the survey. And this is a representative survey of New York City, so this provides us with population estimates of linkages between neighborhood characteristics and effects. And we're building upon our earlier work in which we classify food outlets as being BMI healthy or BMI unhealthy. And we're trying to move away from just focusing on fast food as if it were a single food outlet that's in complete isolation from everything else is going on, or just focus on supermarkets as if supermarkets like existed in some kind of vacuum. And we're trying to think about the food environment in terms of ecological terms, and to think about how the food environment is linked to the larger retail environment, and start thinking about ecologic niches within the food environment, thinking about ecologic succession as neighborhoods change. And so we've been working with measures that relate to the density of food outlets, the diversity of food outlets, and typologies of food outlets to try and build a more sort of holistic model of what this food environment thing is. I'm going to buzz through some quick results. What you're seeing here is statistical analysis results that indicate the association between 3 neighborhood level variables and BMI for the pooled data from New York City from 2002 to 2006. So the red line represents no difference, and the red dots represent an estimate of the difference. And so what this figure attempts to tell you is that if you look at zip code poverty rate, as zip codes are poorer, then the residents have got a significantly higher BMI. As the proportion of the food outlets that are in those zip codes as that proportion of BMI unhealthy, the outlets that we've labeled as unhealthy, and I can go into that methodology offline, what you see is a significantly higher BMI. And what you also see is as the density of outlets, so the number of outlets in a zip code goes up, BMI is negatively associated with this. So this is a statistical model that takes into account these 3 variables simultaneously and all of these other variables that we have in this model. So there's like 40,000 people in our data set, so we can have these really elaborate models. But what we're seeing is a role of poverty, the proportion of food outlets that are BMI unhealthy, and actually a good effect of having areas with lots of food outlets. And we can map this. On the left is the outlet density, and on the right is the proportion of unhealthy outlets by zip code. And what you can see are there are areas in New York City with very, very high density of outlets, but actually a relatively low proportion of BMI unhealthy outlets, and vice versa. And then you can also see areas of New York City where there's a high density of food outlets, and a high proportion of those outlets are BMI unhealthy outlets. And so we have this mixing of sort of density and typologies across New York City zip codes that sort of starting to define what we're hoping to think of as sort of this ecology of food outlets in New York City. One of the things that we see in our work is quite often the association between a neighborhood variable and the outcome variable depends on how poor or rich the neighborhood here is. So what I've done here is we've stratified our data into people living in zip codes that are on the low poverty and high poverty. And on the left panel, what you can see is that the association between unhealthy food outlets and BMI, which is the red line that goes up, is this effect of as the proportion of unhealthy food outlets increases, the average BMI is significantly increasing, but it's only happening in the low poverty neighborhoods. So in the high poverty neighborhoods, there's no actual association between access to these unhealthy food outlets and BMI. When you look at density, which is the right panel, what you basically see is the red line and the blue line are basically parallel. What this says is that it doesn't matter if you live in a high poverty or low poverty neighborhood. As the density of food outlets goes up, BMI is going down, or there's a negative association. And so we're seeing these interactions between neighborhood poverty and access to different types of food and density of food. Ooh, I have 5 minutes left, which is perfect, because I'm going to go on to my second slide. The other thing that we've been looking at is what has been the impact of the restaurant inspection grades being posted in the windows of the restaurants. And so we have downloaded all of the inspection data available for all of New York City since the beginning of 2009. We took the grading algorithm that's been published by DOH and we applied it to all of that inspection data throughout the life of the inspection data. So we've assigned grades to restaurants back even before DOH was assigning grades to restaurants, but using their same algorithm. And what you see is before the policy went into effect, which is July 2010, you have the A-grade restaurants and the B-grade restaurants and the C-grade restaurants, and I've plotted the frequencies. And you can see that the B-grade restaurants were starting to edge up, the frequency of B-grades were edging up, the frequency of A-grades were edging down, C-grades were kind of where they are. After the policy goes into effect, what you see is that the frequency of A grades goes up dramatically. The frequency of B grades goes down substantially, but the C grades is just totally flat. And so because we know each restaurant's address and name, we can look at the transitions. And what this effect is basically all the B grade restaurants stepping up their game and getting over that threshold to become A-grade restaurants. But you can see almost immediately that DOH said that restaurants have to post their grades. There was a sudden change in behavior in terms of A-grade restaurants going up. We've also geocoded every single restaurant for every single inspection across the city, and we've contextualized each restaurant. And what I'm showing you here is the score. So a high score is bad, okay? So having a high score on your inspection data is bad. And what you can see is that once the policy goes into effect, you see a decline in scores, which is good for both low income and high income tracts. But it starts off and it's steeper for the high income track. So once again, from sort of a fundamental causes perspective of health, it's the high income neighborhoods that immediately benefited from the posting of this, with the inspection scores getting better. So the gray bars are actually the 95% confidence interval. So all of these are like vastly statistically significant differences. We've also looked at restaurants in high-density neighborhoods and low-density neighborhoods. So a neighborhood that has a ton of restaurants versus a neighborhood that has a modest number of restaurants. And what you can see is actually throughout the life of the inspection data, restaurants that were in neighborhoods that had relatively few restaurants had better inspection grades. And restaurants that were in neighborhoods with lots of restaurants typically had poorer grades. But once the policy goes into place, there's this weird sort of S-bend ski slope swoosh that happens. But what you see, it's the restaurants in the neighborhoods that have got a high density of restaurants that really step up their game and get better grades, quite quickly, in fact. And so by the time we're out to 2012, the restaurants in low and high density neighborhoods have basically equalized their inspection grades. And so I was looking at the New York Times, and there was this like little ticker thing where each mayoral candidate was asked their thoughts on food inspection, and a number of the candidates seemed to be saying it was a burden on small businesses, they weren't necessarily in favor of restaurant inspections, so on and so forth. So I look at our data and I see like just posting an A or a B on the window has had some significant impacts on sort of like how clean that kitchen is in the restaurant that you eat in. So my view of the priorities for food policy research, I think we need to keep developing a better understanding of the food environment as an ecologic system that is part of a larger retail ecology. And such systems have niches, undergo ecological succession, partially linked to ideas around gentrification. So understanding sort of the long-term trajectories of neighborhoods in terms of their food environments over, say, 10 or 20 years is our new objective. And so we have 3 papers that have come out this year where we've started talking about the food environment not just as, hey, there's a lot of fast food joints in this neighborhood, or hey, this neighborhood doesn't have a supermarket, but thinking about the overall ecology of each neighborhood. The second thing that we're interested in is understanding what different communities want from their food systems. When we do qualitative work amongst immigrant populations in New York City, what we learn is they didn't actually want new supermarkets in their neighborhoods. What they wanted was farmers markets and more places to get freshly killed meat, either at farmers markets or at small butchers. And so we have a paper in 2011 where we begin to ask the question, in these neighborhoods that we've labeled food deserts, what do people actually want from their food system if we were to give them a new food system or create policies that impacted their food system? And our last thought is disparities, disparities, disparities. What we repeatedly see over and over and over again in our work is that the differences in obesity, the differences in diet have got these radical socioeconomic and racial ethnic differences. And the impact of an environmental factor in a neighborhood on BMI or on physical activity is also conditioned on socioeconomic status. So understanding how disparities play out both in our outcomes, so diet and BMI, and how disparities play out in the impact of policies in different communities is one of the things that we think is really important. And I think I'm about to get the 0-second sign, so thank you much.